This is a general explanation of epidural anesthesia. This explanation assumes that it will be performed in combination with general anesthesia. Please adjust the playback speed to make it easier to understand. The brain and spinal cord are suspended in cerebrospinal fluid, which is enclosed by a tough membrane called the dura mater. In epidural anesthesia, a very thin tube called a catheter is inserted outside the dura mater. Epidural anesthesia is considered safer when performed before the patient falls asleep under general anesthesia. Therefore, in most cases, it is done while the patient is still awake. Just before general anesthesia takes effect, the patient may be instructed to turn to the side. At this time, curling the back like a shrimp helps open the spaces between the vertebrae, making the procedure easier. After the anesthesiologist confirms the position of the spine, the area will be disinfected. Once the disinfectant dries, a sterile drape will be placed. The anesthesiologist will then give a verbal cue before injecting a local anesthetic with a fine needle. Once it is confirmed that the local anesthetic has taken effect, the epidural anesthesia procedure will begin. Epidural anesthesia involves passing a needle through the spaces between the vertebrae to reach the area just outside the dura mater. Since this is a highly delicate technique, it is important to remain as still as possible. If any unusual sensations, such as a sharp, electric shock-like pain, are felt, the anesthesiologist should be informed immediately. Once the needle is properly positioned outside the dura mater, a catheter will be inserted and secured with tape or other means, completing the procedure. Precautions. There are certain conditions under which epidural anesthesia may not be possible. If any of these apply, they should be communicated to the anesthesiologist. Additionally, if the spaces between the vertebrae are extremely narrow, the procedure may not be successful. In such cases, an alternative method, such as a nerve block, may be used instead. Complications. Rare complications of epidural anesthesia include epidural hematoma, persistent bleeding outside the dura mater that compresses the spinal cord, nerve damage, and local anesthetic toxicity. More common complications include the following. If severe pain, numbness, or discomfort occurs, medical staff should be contacted immediately. This concludes the explanation. Thank you for your attention.